All right, Brad. The question we have is, if you have back pain, do you have inflammation in the back?
Bob and Brad, the two most famous physical therapists on the internet.
All I'm saying is if it hurts and it's painful when you move, you probably have inflammation.
Right. Let's talk about it. If you have a really constant, severe pain, that's a good chance there's some inflammation there.
Sure. Yep.
So a flare-up of pain, if you went out and did something stupid, I mean, it's
Yeah,
often-
went out and cut a tree down in the backyard and moved all the wood by yourself with poor body mechanics, and then it hurts for the whole night and the next
It's just
day.
like spraining the ankle.
Yep.
You're going to get swelling in there. If you have trouble sleeping at night, you're lying down.
Yep.
You would think it should not hurt, right? But if it's actually swelling in your back, it may hurt.
Right.
Finally, if you have it hurts all the time when you're standing or walking.
That chronic
yeah.
situation, yeah.
So it doesn't matter what your diagnosis is, if sciatica, spinal stenosis,
Spondylolisthesis.
whatever it is, inflammation is going to make it worse.
Right.
So your first step should be to try to reduce inflammation
Right.
for at least a 5-day plan.
Yeah.
So
Sounds like a reasonable,
So-
an exceptional plan, Bob, actually.
So one of the things you actually want to do is walking. Walking helps get moving, and it actually helps the swelling go down.
Right.
So
If it's so flared up that walking makes it worse, which I've experienced as well as
Yeah.
patients, then we're going to show you how to settle it down and then get to walking when you can.
right, you could try a back brace.
Sure.
It might feel better when you walk. We got a couple here. Brad, you want to show yours?
Yeah. If you don't have one, I don't know if you really want to go out and buy one. I would try some of these other tools.
Right. They're less expensive.
So, and these aren't that expensive, actually. This one has elastic. We go to here. We like the kind that you can keep reasonably loose and then adjust. Like when you're walking, you may want to tighten it up and get that, and you feel that support. It should feel like good support as soon as you tighten it up.
Right. This works the same way. There's one
Yep.
Velcro closure here, and then I can tighten it by
Oh, these things. This one actually is a
Really
little
cinches
more
up.
supportive than this style, which I like that one.
So if this allows you to walk and you can't walk without it, it's a great thing to do.
Yeah, stabilize that pelvis, and eventually you take it off when you can. You don't continue to wear it forever.
A little less active thing is actually get a right position and use the ice pack. So,
This has been my go-to personally, as well as patients that come in with severe back pain. I'll have them lay down. You can use pillows. This wedge actually works better for at least 90% of the people I've worked
Yeah.
with. So,
and I would
and
say,
you can do this on your bed or on the floor.
yep,
Cold pack when it's really flared up for most people is what my go-to or advice is. Get that underneath there, here, and I've done this literally when I'm out doing yard work because I'm guilty of that. I like doing yard work, and I break the rules sometimes. Literally in the middle of the day, I'll go in, lay down like this with a cold pack for 20 minutes, get up, relax, and then I go back out and I
Right.
behave myself. Though I won't
Yep.
do things I shouldn't be doing.
and you're also going to lie down.
I'm getting to the point in my life I don't care about it.
Yeah.
But I
But
know, you're
it-
right, I
oh,
should.
And you could do it throughout the day, by the way, for 10 minutes. I mean, if you want it, you could go longer, but I like to see, if you're really flared up, do at least twice, maybe
Yep.
4 times, where you get on the ice pack and get the legs up.
Yeah. I am so comfortable, Bob, right now. I think we could finish a video
All right,
in this
let's
position.
get up, Brad.
It really feels good. And I don't even have any flare up right now.
All right, what else are we going to talk about?
Did I say lay?
Yeah.
I can't believe that. I thought it was
All
over
right.
that.
If you're having trouble at night sleeping
Mm-hmm.
because of the flare up and the pain, you might want to actually wear the back support or back brace at night,
Sure.
because whenever you roll over, it's going to hurt, and this will help stop that.
Stabilize it.
Give
Yep.
it a try. So we're not worried about your back getting weak during sleep because you're
Right.
not working out too much. So, and last thing is avoid pain makers for now. Like, let's say
Where do you get a pain maker?
there could be a whole list of them, Brad.
Actually, I guess we've gone over that in previous
Right.
videos with this.
You don't want to be riding a snowmobile when your back is flared up.
Right.
You don't want to be shoveling snow.
You're right.
You might want to be cutting lawn.
Yeah, on a riding lawnmower, boy,
Right.
that can really tear it apart.
So until your life calms down,
Yeah.
you can reintroduce the pain makers.
Right.
Then at that point. So,
With good judgment.
all right. Remember, get that back, calm down.
That's right. Feel calm and relaxed.
All right. Take care.